And nowhere is the need for a new direction and fresh thinking clearer than in our National Health Service. There's not a person in this room, and there's not a life across the country that's not been touched by our NHS. Labour's greatest ever achievement, the NHS has been a life-saving pillar of our society for almost 80 years. The NHS is what brought us into the world. It has cared for us at our times of need, and it has looked after millions of Scots in their final hours. Fixing our NHS is personal to me. It's in my DNA. Before politics, I worked in our NHS as a dentist in a part of Paisley with some of the worst health inequalities in Europe. I saw firsthand the human cost of poverty and how it affects the health of Scots. But I also saw firsthand the life-changing power of our National Health Service. But conference, can we really claim that the founding principles are being met for every Scot? Today in Scotland, 1 in 6 people are stuck on an NHS waiting list in pain and anxiety. Patients are treated in corridors by staff who themselves have been failed and are hitting breaking point. The NHS crisis is costing lives. And the sad reality is that an NHS free and available at the point of need has been shattered by the SNP. That's why today I am saying clearly, as First Minister, I will declare a national waiting times emergency and do whatever it takes to fix our NHS. A Scottish Labour government will make clearing the backlog and cutting waiting times our day one priority. And let me tell you how we will deliver that new direction for Scotland's NHS. We will maximise existing capacity, create additional capacity, and use digital solutions for faster diagnosis and faster treatment. Currently, the NHS, despite more resources and more staff, is delivering fewer operations and fewer treatments than before. Vital capacity is actually going unused. That's why we will ensure patients are seen based on need and not an outdated postcode lottery or their ability to pay. Instead of a system that puts health boards and their managers first, we will put patients first. Health boards will only be paid when they deliver the care people need. Under our plans, the money will follow the patient. And conference, to deal with this national emergency, we will use capacity wherever it is, even if it means travelling to other parts of the country or using private sector capacity to save lives. Because be in no doubt, as First Minister, I will do whatever it takes to fix our NHS. We will also plan for the future of our health service. Because the reason why we're stuck in a crisis is because successive SNP governments have entirely failed to ensure our NHS is fit for the future. That's why I will take on the top-heavy management that is holding the NHS back and deliver the biggest and most meaningful NHS reform in decades. And we can't ignore that so many of the challenges facing our NHS are due to a failure to get to grips with the primary care and social care crisis. All of you will know the ATM rush to book GP appointments. Many of you will be familiar with the text message, "Don't bother calling, there is no appointments available." Or after hours on the phone, being told to call back tomorrow or go to A&E. That's why, as First Minister, I will end the ATM rush and I will rewrite the GP contract so that you can be seen within 48 hours of your first call. And we will tackle the crisis in social care at its roots with proper workforce planning, proper local government funding, and as First Minister, I will deliver a proper national care service.